There are some women that change their pads every 1 to 2 hours in a day, and there are some that have very increased number of bleeding. Let's say 7 days, they are still seeing their menses with heavy clots. You see their blood coming out in clot as big as a 1 naira coin. If you are among this category of women, then I think you may be having menorrhagia. Yes, menorrhagia is a medical condition where a woman is having abnormally heavy menstruation or prolonged menstruation or prolonged bleeding. Yes, normally a woman, maybe for example, Esther used to see her menses for 3 days normally or 4 days highest. But all of a sudden, Esther is now seeing her menses for like 7 days, 8 days, sometimes spanning to 10 days. Or Esther is seeing her menses and is so heavy to the extent that every 1 hour, every 2 hours, she's going to change her pad, and they are fully soaked. All right. Or maybe for example, she used to use, let's say, 1 pack of pads per menstrual cycle, but now she's using like 5 packs. That is definitely not definitely, because in medicine never say never. It may just be menorrhagia. Yeah, so if you have any of these symptoms, I advise you go to the hospital for a medical checkup. So that boils down to, what are the causes of menorrhagia? Yes, menorrhagia is caused mostly by hormonal imbalance, where there is an imbalance between the progesterone and estrogen. And once there's an imbalance between these two hormones, then there will be an increase in the thickening of the uterine lining that will lead to heavier bleeding. You've learned new thing today, Abby. Number two cause is uterine fibroid. This is one of the highest cause of menorrhagia in our environment. Yes, most women with fibroids, they have this heavy bleeding that will span for a very long period of time. You keep seeing them bleed. Sometimes we call them funnily or jokingly, maybe the issue of blood, because their bleeding never stops. All right, that could be a cause of menorrhagia. Another cause could be that you've been taking some medication like blood thinners. Okay, can be a cause that you're having this menorrhagia or heavy bleeding. Another cause could be that you have maybe some conditions that are bleeding disorder, like von Willebrand's disease. It could be that you have that kind of disease, so it's your bleeding continuous. The clotting system is faulty, so it's no longer clotting. So you see yourself bleeding excessively. All right, even some conditions like hyperthyroidism, hypothyroidism, that is in general thyroid disorders, can be a cause why you're bleeding more than normal. All right, so if you have any of these symptoms, you should go for the hospital for a proper checkup. Now, why is menorrhagia a concern to us medical doctors? It's because once you have this bleeding month in, month out, with time your blood level will go low and you'll be anemic. And anemia is not something that you should joke with, because if your anemia is not treated, it can lead to anemic heart failure, which is another major problem. All right. So another thing that makes us want to make sure that your menorrhagia is checked and treated is that it makes you dizzy, you can faint, and then it alters your quality of life. You begin to have poor quality of life because it no longer allows you to go out for walk. It no longer allows you to do your normal activity that you used to do. So if you have any of these symptoms, changing pads frequently, heavy bleeding, fully soaked pad, then I think you should go for a medical checkup to rule out the causes and to be on the safe side. All right. So, like I said, menstrual pain, menstrual bleeding is not supposed to stop you from doing your normal activities. Once it does that, then it's a cause for concern and something else might be going on. So you should get your checked today. Do have a nice day. Bye bye.